Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzo.
And I'm Dr. Cheng, endocrinologist.
Dr. Cheng has joined us to talk about maybe the single most important topic within endocrinology, and that's how sweet you are. And we know that our audience is very, very sweet, but some of you may be a little bit too sweet and on the path to potentially having an issue with your sugar. So we're going to talk about the term pre-diabetic, or having elevated sugars on a regular basis. What does this mean for people?
So we make the official diagnosis of diabetes based on your blood sugar level when fasting, so the fasting blood sugar of 7 millimoles per liter or greater,
Okay.
or based on an A1C blood test, which is a measure of how much sugar is stuck on your red blood cells. Your red blood cells live for about 3 months, and that A1C, if that's greater than or equal to 6.5%, we consider that diabetes. And then there's another test we could do with a sugar drink, et cetera. We don't do that as so often.
The tolerance test.
Yes, exactly.
Okay.
So that is how we officially diagnose diabetes. But there's sort of like a waiting room to diabetes where someone has pre-diabetes.
And it's busy.
So their numbers are above normal, but not quite at the range of diabetes. So in Canada, we define that as a fasting sugar of 6.1 to 6.9. 6.9,
Okay.
And then the A1C of 6 to 6.4%.
So just
Okay.
a little lower than the threshold
Correct.
to diagnose that you have diabetes. You might be living with pre-diabetes.
Correct.
So you go to your doctor, you have this test, and they say you're pre-diabetic, or you have slightly elevated sugars, but not formally diabetic yet. What does that mean for that person?
So the reason why this sort of category was even named was because those individuals, needless to say, are at higher risk of progressing to diabetes. So our jobs at that point is to reverse that train and sort of get out of that waiting room and go back out to the other side. And that is achievable through lifestyle modifications or medication. Certain medications have also been shown to be effective.
Okay, so our viewers love lifestyle modifications. So what do we mean when we say that when it comes to elevated sugars?
So the lifestyle modifications are through food as well as through physical activity and through weight loss for most people.
Okay.
So food choice-wise, portion sizes, it's about carbohydrates and the proportion of carbohydrates, protein, vegetables, etc.
Yeah.
And trying to work on that. And then the physical activity part is moving, being as active as one can be. Doesn't mean join a gym, it doesn't mean run a marathon, it means be physically active. And those two things together will usually result in some weight loss,
Okay.
which is ultimately going to then reduce that risk of progressing to diabetes. But one thing I really want to point out is that genetics is by far the biggest predictor of whether one gets diabetes.
Thanks, Mom.
And I
Thanks,
have
Dad.
to say that because sometimes people beat themselves up,
They feel guilty.
right? So they feel guilty when they progress to type 2 diabetes diagnosis, and they're ashamed of it and they don't want to tell people. And I feel terrible when I see that because it's not your fault. And I think it's really worth re-emphasizing it is not your fault.
Awesome.
This is very much genetically driven. All one can do is try to slow down that course,
Yep.
but genetics is still by far the biggest predictor.
It's your genes, not your
genes.
skinny
It
ones,
is.
Brad.
It's-
Not your skinny ones.
No, they're going out anyway. Okay, so how long do we try the lifestyle modification before we say, okay, now we tried and it didn't work, or your sugars are slowly creeping up, you're still not formally. When do we start talking about medications for this?
Very individual, right?
Okay.
It depends on what's realistic for that individual. It depends on the progress, et cetera. But usually like a good 3-month trial
Yep.
is a very reasonable starting point. And then the medications we might consider then would be metformin, which we've had forever, decades and decades, old, safe, effective. Acarbose also has evidence, but acarbose does carry side effects of flatulence, which people tend not to like.
Okay.
Paul?
Tooting, so people tend not to like that one. And then there's another set of drugs, pioglitazone, rosiglitazone, but those also carry some side effects with them. So typically it's metformin
Okay.
that one might consider for sort of slowing down that train.
Okay, and so in terms of your diet that you're going to try for 3 months or so, that's reducing carbs, you're saying, as a proportion, increasing your physical activity. You're going to try that for up to 3 months, and then recognizing that often it's genetic, not your fault. So then a medication may be added, and those are the classes. One that has been around forever, metformin. One that makes you toot.
And the plan would be that as long as that worked, then you can stay on that plan. But if your sugars keep rising despite lifestyle modification and that medication, then theoretically you can go into stronger medications up to and including insulin.
Yes, although I'll change that language a little
Okay.
bit. It won't be up to and including because that would suggest that insulin is sort of like the last resort,
Okay.
because it really, I prefer to think of it as we've got a toolbox
Yep.
of options to lower that sugar. And depending on the kind of diabetes you have in terms of what's going on in your body, we pull out the tool that we need.
Everybody's a little bit different.
Right? We pull out the tool that we need, and it's not necessarily sequential in sequence in that.
And I think that's how people see it, is that
Yeah.
insulin is the last line,
Yeah,
and that
yeah.
if it's everything failing, just give me the insulin
Yeah.
and let's move on, and then I'm done.
Yeah, and
Oh, okay.
let's not think of it that way.
Okay, that's right. See, I like to demonstrate things that you shouldn't do.
How not to think, with Dr. Wien.
Okay, that is an awesome summary, and I think it's going to answer a lot of questions for people who are kind of on that bubble and they're not sure and they're nervous for sure. And like you said, they feel guilty. So if you have one take home from this video, please take home that it's not your fault and that there's lots of options for you to get treated and get the care that you require.
Lifestyle only goes so far.
Yeah.
Genes play a big role as well.
Okay, if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
And thanks to Dr. Cheng for joining us again.
Thank you.
Thank you.